our panel has taken us on quite a journey, from ground truthing the reality of the technologic challenges to keep a cell phone powered and get a story out, through Rob's discussion of new platforms for communicating the stories that emerge and the widespread access that can be created with these new platforms. Through the story of the importance of the role of the diaspora in fostering linkages and being part of a response, even at a distance, to Nancy's, I think, perfectly sequenced summary of challenging us to think about what the meanings of the images, the meanings of the words chosen, and really looking at both the positive and potentially the less positive aspects of the role of the media in the response. So it's been a fabulous 4 presentations, and I'd like to open it up to the audience for comments or questions. Monica?
Thank you. My question is for Magnolia.
Yes.
Thank you for the good presentation. And as you are speaking, I could see the passion in your eyes and the desire to get the balance in reporting, and also the good work you did at the diaspora for Haiti. And I was wondering, if you look back, 2020 hindsight, what would you do as the diaspora to try and bring a balance in the reporting, which, you criticized? Because I think there has to be somebody to try and do something, and I think you're in a very good place to try and bring some balance, some objectivity. How could you bring that to the fore so that it counters the international media, so to speak?
That's a very good question. I think it's already happening. You see, if you look at the comparison between how the hurricanes were reported on and how the earthquake was reported on, there was some improvement. There were more Haitian voices. New York Times ran several different Haitian commentary, the Washington Post, USA Today. So you saw there were more diverse voices, more Haitian voices in the international and national media. So that improved. That has improved. We have a ways to go, but that has improved. I think one of the key things is to continue hiring and grooming people who were going to report on, to have linkages with them. The fact remains the same. I'm the only woman of color editor in a community newspaper in all of New England. Now there are magazines, right? We have magazines, there are tabloids, but I'm the only one. And so what does that say in terms of our community papers, making sure that we have more diversity in the editorial boards, people who can make decisions, people who can fight for stories that matter? What we did, for instance, we took that own responsibility that you referred to in our reporting. When everyone was talking about the elections, our cover was about the tent camps. We had a whole cover, we had a whole in-depth reporting done from our freelance journalists in Haiti about the tent camps. So when the media glaze was on the lights and the sexiness of the elections, we were talking about hard realities that still existed on the ground. So I think that's key for us to keep doing that. The third thing I'd add to that is there's a reality in terms of how we look, what our worldview is as Americans or as people who live in America, and that there's a very paternalistic view of other countries, especially impoverished countries of people of color. And so I think that is something that we need to be mindful of, and to be open, to be challenged to. I think that's something that's key for us as Americans, or people who are living in America, to be mindful of that. And I think once we can continue this trend I'm seeing, this trend of having more different voices, more diverse voices, more women, more people of color reporting and part of the media, I think that we'll see a drastic improvement of how these sort of disasters are reported on.
Jane, you had a question?
Also for you. Now, you said that you were unable to get to Haiti right away after the quake. How long before you got there?
2 months.
2 months?
Longest 2 months of my life.
I'm sure. Talk to me a little bit about what you looked for in the media coverage. I'm very curious from your perspective, having been active in both United States and Haiti.
I was looking for stories where that talked about all the different resources that were being funneled to Haiti. I just saw just one trend. The international NGOs were doing great. I just saw that one trend. I didn't see any of the Haitian grassroots. Forget the diaspora for a second. Just the Haitian grassroots, the civil society organizations that many of the international media rely on as their connections when they're in Haiti. Right, the civil society groups. I didn't hear much about them because at the end of the day, they're the ones really providing the front line of relief. So I was looking for that. I was also looking for to criticize U.S. policy towards Haiti. We're squandering U.S. dollars in Haiti. That frustrates me as a Haitian American. I do pay my taxes. Actually, I just got the phone with my cousin who told me I need to get my taxes from him. So to me, I think it's important as U.S. citizens for us to think about how our government, what our government's policy is towards a place like Haiti. I didn't really see the media really challenging and criticizing the current administration for the lackluster policies that it has continued. The Obama administration has not shifted its policies on Haiti. It's the same as Bush. And one can argue even worse because the Obama administration started deporting Haitians a year after the earthquake. So I would have liked to see more of that. I would have liked to see more of the 3 to 6 month period after the earthquake, when so many advocates were talking about an impending public health disease outbreak. I would have liked to have seen that covered more because that is really important in terms of how we're using our dollars in the relief efforts. So I would have liked to see more critical reporting on the international organizations, frankly, the American ones, like the American Red Cross and some of the others that are more prominent in Haiti.
In the back here.
Good afternoon, panelists. Ben Timmons from the BU College of Comm. Just a quick question for those who worked in Haiti. I was wondering if you could kind of juxtapose the Haitian quake with that in Japan. I heard a little bit of kind of poverty pimping, I think was the quote. We saw some pretty differing coverage between a quake and a tsunami that happened in an OECD or really a G8 nation and one that has frequently over the past few years been used as a poster child for the $1-a-day children. I was wondering if there was some kind of a connection or a separation between the two of them.
You can go first. I'd be curious to hear from multiple.
Before I answer that question, I want to make a comment further on what I think is Nancy's extremely good point about journalists placing burdens upon countries that have just been hit by disasters. Does anyone here actually want to be a reporter and cover this sort of thing? Okay, quite a number of you. If you do go into a country that has been hit by a disaster, you must be self-sufficient. You must have your own food, your own water, your own drugs and medicines. You cannot, as a journalist, with any ethical compunction at all, be a burden on these countries. I mean, that is an extremely important thing. And I also think you ought to be mindful of, as Nancy said, that the ministries and the places that normally feed you information have been destroyed. And as journalists, I think it's really important for you to develop other sources besides, going to official press conferences, especially because after Haiti, the earthquake in Haiti, they didn't really exist. And so everybody's going to run over to the UN, and they're in a little compound, and they don't even know what's going on. So that's one thing. Now, the difference in the coverage between Japan and Haiti is sort of a difference of baselines. Now, we have written a lot about Japan and their earthquake-proof buildings. Well, Haiti was not coming from a situation where they had even building codes that would put them into the standards of U.S. building codes or even building codes in the Dominican Republic. They were coming from a different place, and they had a completely different set of resources to pull from after their earthquake. The capital was destroyed in Haiti. The earthquake that struck Japan destroyed, a northern city and left Tokyo mostly unharmed. So the seat of government was still operating. The communications were, for the most part, still operating. And they had heavy equipment. In Indonesia, they had a mall that collapsed, and the mall stayed collapsed for a very long time because they didn't have heavy equipment to pull the walls off the people who were buried there. So that's why you see differences in coverage, because you have differences in resources between a first world country and a third world country.
Go ahead, Nancy.
I think the proximity also, the fact that Haiti is so close to the U.S., and the fact that Haiti had been in the news a lot already, because even our office, the Office of the Special Envoy, people forget that it was established pretty much 6 months before the earthquake as a result of a series of hurricanes that had beset Haiti. And so one of the things that I discovered as I was thinking through my remarks today is that 25% of news in general is about some kind of natural disaster. There seems to be something in the general public that really is curious, interested, compelled by those kinds of things. There's it's like the definition of an emergency. It has a beginning, it has an end. It has action, it has gory pictures, it has a lot of movement, and it makes a good picture, a good headline, a good footage. And so when you're in the backyard, literally, of the U.S., and there's been that long and complex history of Haiti and the U.S., it's very easy for people to come down and to, in some ways, validate the most impoverished country image and those resilient people and those poor people and what else is going to happen. The country with the most NGOs in the hemisphere, and what does that mean, and what's going to be the outcome. So all the elements were there for a kind of frenzy, a kind of accessibility, a kind of proximity, and frankly a kind of familiarity. So what's happening next with the neighbors?
Question for Donna. So Donna, with your 32 hurricanes and storms, and I should also stress that when we first contacted Donna, she was in Arizona covering another kind of disaster, and that would be the shootings there, including Congresswoman Gabby Giffords. How do you avoid disaster fatigue on your own as a reporter, and how do you go into each of these different complex emergencies and not think, oh yeah, disasters are us, another day, another disaster?
Mm-hmm. I have to say that I've never encountered a disaster that wasn't compelling or interesting or completely different. Each one has its own set of challenges. That's why we haven't devised in the U.S. some sort of cookie-cutter disaster response where we can pop into a country and fix everything. So each one is really different. In my head, the only things that get a little mixed up is sort of which hurricane was named, Gustav, and which one was named Ike. But they all, I know which one the roof collapsed on my head. I mean, I know which one, destroyed Galveston, that kind of thing. They are definitely very distinct, and they each have their own sort of personalities. How I don't get burned out on these things, the DART Center for Trauma actually kind of studied gave me a little psychological questionnaire sort of thing to try and figure out why I will go back to disaster after disaster. In fact, there's a cadre of reporters, and we see each other at every disaster. We all do the same thing over and over again. And DART never gave me any sort of answer about what it is about my personality, but I think it's kind of the way I see people, and that is every disaster I have ever been to, no matter how horrific it is and where it takes place and who the people are, white, black, Haitian, Japanese, whatever, what you always see after the disaster is that people wake up in the morning, they do their best to clean up, they do the best they can to comfort and find their families, and they try as best they can to move on with their lives and to pick up the pieces. And to me, that shows a great deal of optimism and resilience among people in general.
We have time for one last question. Or actually, maybe we can slip in two if we make them tight.
I worked at the intersection of the media. As I mentioned earlier, I was in Haiti since May of last year, working for the Ministry of Culture and Communications. And I was struck by Nancy's comment about the arrogance of reporters saying, bring me the minister, bring me this, and not realizing at all how much of Haiti's leadership was lost, how their buildings, the ministry buildings, were crushed. But I thought the height of arrogance, in a sense, was organized by some local NGOs when they had the 6-month anniversary of the quake, and they scheduled the reporters to meet at the Montana every day, and they really ended up talking to the international community. Our press conferences were down at the Ministry of Culture and Communications next to Champ de Mars, next to the presidential palace, and we got angry and said, how can you do that? How can you go have invite all the reporters to the Montana and not come to the, do you just want to talk to yourselves? Or do you want to actually talk to the government? And finally they got a bus and we coordinated. But I mean, there is something from, I started to see things from the government perspective because that's who I was working for. But so many reporters came down there with their minds made up, with their stories already written in some ways about how the government, is doing nothing. I mean, nobody ever told the story about, for example, how 2 million people were vaccinated. There wasn't a massive, epidemics. I mean, the cholera was a different story, but, during that summertime after the quake, the Ministry of Health and UNICEF got together and vaccinated 2 million people.
I'm going to take that as a comment and give this man the chance for a last quick question.
Hi, this is directed towards all the panelists. I have a question about keeping a story fresh. So disaster reporting, Haiti, disasters in general, a year after the initial disaster happens, how do you keep a disaster in the media at the top of the headlines?
Which happens to be the topic of our next panel. So I may actually use the power of the chair to actually hold that question for John Sawyer's panel, because in fact I think that is the theme to it. But allow our panelists last comment or two if they'd like to make quickly.
Oh, there's another question out there.
Oh, and there's another. Well, there was a comment or question on that?
Yes, really quick. Well, in Haiti, we just we get creative. We elect very popular singers. We have a hurricane in the midst of that.
Cholera epidemic.
We have cholera epidemic. So we found very creative ways to stay in the media.
I have no trouble getting a Haiti story in USA Today.
Well, now I see hands. Quickly, if we can. We're cutting into our own break, but it sounds like we should go forward another few minutes.
One thing that struck me was after the second presenter, you said everyone becomes the reporter. And then we're talking about the negative connotation with reporters. I think it's because the word reporter is just thrown out to anyone with a notepad or with a camera. And for me, being in photojournalism, I get really OCD when I crop out a light that has no meaning but screws with the composition. And so I think that if I just pulled a steak out of a person, someone wouldn't be like, that guy's a doctor. But I think a lot of people are labeled as reporters, and that might be a pretty big problem. So maybe that's a problem with like the media, is that anyone can be a reporter, but I mean, I don't know if you guys see that at all, but perhaps.
First of all, don't ever pull a steak out of someone. They'll bleed to death. You're supposed to leave the steak in. I learned that in first aid class.
Question from the back.
Do you ever feel that reporters should advocate for any policy change? I mean, that was kind of brought up in the previous panel.
Is that for her or for me? Well, I'm an editor, so it's a bit different case. Do you want to respond first?
Go ahead.
I come from that background, and I remember sitting with my managing editor and my publisher when it wasn't my idea to come run a paper, by the way. And I said to them, I said, why would you take an advocate, and to come run a paper? And he said, because we know you can use this platform if you see fit to advocate for policies that need to be advocated for. So I'm not sure it's a reporter's job to do that. I think reporters, we need them to stay neutral. We need reporters to stay covering the facts and investigating. But I think the editorial board has some latitude to really, really illuminate some of the challenges we have in our policy and how we deal with countries. So I do think there is a role for the editorial board to play. But to the gentleman's question earlier about journalism, I take it very, very serious that I don't do the same reporting that my news editor does. And whenever I'm writing a news story and I switch that hat, I always go to him and have him oversee everything and make sure that it's neutral, make sure that I'm not coming from a biased standpoint. And we have respect for that because my role is a bit different. I think it's key to respect the institution of media coming from a place like Haiti where it's not a big institution. I think one of the reasons why the reporting was so poor is because there was not a strong media institution in Haiti already. And so that we rely and still rely on the international media to give news in Haiti. So I would, I think yes in some cases, but for journalists, I think it's important for us to respect this institution and this profession, because at the end of the day, without journalists, we don't have any information to work with. And I'll let Donna respond.
My short answer to that question is that no, journalists should not advocate for particular policy or social change. We ought to present you with a picture of what we see, of all the facts that we can gather, and let you or policymakers or whomever come to the conclusions about what needs to be done. Now, the long answer to that is that we all come to this job with biases. We come to the job with biases as Americans about what things should look like and how things should be, and that children should be healthy and have food and be vaccinated and be educated, and we have certain cultural assumptions that we make, and we have to try and set those aside as best we can. But I know, and I know that you all know, that when you go out looking for a story, you're going to approach it with a certain eye, and that eye is colored by who you are, and it might be colored by what your editor is more likely to put on the front page. And, so then you end up being advocates for different things. I mean, at some newspapers, you end up being advocates for puppy dog stories and cute children's stories because those are the ones that get you on the front page.
Last comment from the back.
Is this working? Yes, it is. Hi, I'm Danit Kaya. I'm a student at the School of Public Health, and I had one comment and then possibly one question as well. Comment is short. What I noticed is a striking balance between the previous presentation and this one, that not only is the media an incredibly powerful role, but there seem to be very large gaps between the partnerships of public health professionals and the media. And what we've learned with Ushahidi is the power of us to actually tell stories on our own and not necessarily just go through traditional media outlets. So one of the things that I would like to possibly suggest or recommend is that we actually train our students in how to deal with reporters and how to work with the media and how to do that in a professional way, so that we can kind of avoid this problem in the future and teach ourselves how to actually operate professionally, especially in a disaster situation where it's not an ideal time to teach us how to ask questions and how to answer them. The question that I had is a tension that I hear, which is that I think public health as a field, because it's so broad, is it's difficult to make relatable to people who don't know the field very well. And I notice this, my mom even tells me, sometimes I have a difficult time explaining to our family, like, what a master's in public health even is, right? So my question to Donna and all of the panelists is how do we keep public health a field that is relatable when we're dealing with the thousands and the millions of numbers, and not just to tell the one person's story? Or do you think that the only way to make public health relatable to people who aren't familiar with the field is by telling the individual story and hoping that people can make the connection that it actually affects an entire population? Thank you.
First of all, I have to say I love my public health people. I mean, whenever I go to a disaster, I see the same ones over and over again, and they're super nice, and I talk to them all the time. And they use the media a great deal because they want to get public health messages out, and they want to tell people what is needed and the work they're doing. I think the tension comes because most people in public health are actually doing public health, and they don't have a media person that is both trained in public health and trained to deal with the media and to translate between the two. And I think that would be really helpful. And I think in terms of doing a story that focuses on the individual versus sort of the numbers or, epidemiology. Okay, epidemiology is really a drag. You are not going to see a story. I know, it's terrible. You're not going to see a story on the front page of USA Today on epidemiology, except that we seem to have one every day. And you know what those are? Those are the stories that we do about maps, about how the population is shifting. So we think it's not an epidemiology story, and we think it's not a number story, but it is. And what we do is we take an individual story as a way to illustrate it, and then we pull you into the statistics, and we give you the broad sweep. So if you are a public health person, think about the overall message and then find a way to illustrate it that somebody who is not in public health can sink their fingers into and grab onto and understand the numbers behind the game.
Mm-hmm. That's exactly where I think that's where I think that my platform and the work that we're doing is headed as well. I mean, Ushahidi would not work if all we were doing was aggregating SMS messages and then spitting out a list of SMS messages. The connection comes when people can see that data visualization and see those points on a map. And where I think it's going, where we still have a lot of work to do, admittedly, is in being able to click on that dot and to drill down and to get the individual story that way. And so we are marrying the data, the raw data, coming out of these situations, such as in Haiti, to show where jobs need to happen, where health is failing in some of these camps, but to drill down and then find that individual story underneath. And hopefully, and I would say, getting to the comments more about the citizen journalism and where everyone's a reporter, the right kind of stories. And we've heard that today in terms of anyone can go here to a sad situation and find sadness. But if you can go down there and find hope and resilience, there's where your stories are going to be. And as journalists, as budding journalists in the room, people going into this field, I think how the shape of journalism is changing is that, no, you're not the only storytellers in the world, in the profession anymore. Really what I think needs to happen is that as everyone does become more empowered to tell their own stories, the internet, these kind of platforms, my kind of platform, is very good telling us what we want to hear, but not really great at telling us what we should be hearing. And we need more people, particularly in I think both these fields, to help us listen.
I'd like to thank the panelists. The purpose of today is to highlight some of the complementarities, but also some of the differences between the public health community and the community, the media community and journalism per se. As an epidemiologist, I love the fact that I can say the purpose of my work is to generate data that allows me to advocate unashamedly, unabashedly for improvements in the health of populations, so that I can not have that tension of trying to remain objective when in fact it's really very, very difficult. We all have history, we all have previous experience and previous points of views. So I think that's one of the places where I think the public health community tries to use the media and the media tries to use the public health community to get that evidence and get that information and package it in somewhat different ways with different underlying assumptions. We're going to take a shortened break of about 5 minutes or so, and then the director of the Pulitzer Center on Crisis Reporting, John Sawyer, will lead the last panel, which is on how do you keep these stories alive and how do you think about disasters in the long run. So a short break. Thank you.